Okay, well, I'm really excited to welcome you, Ellen, to I don't even know what to call this, my platform, my Substack. But I wanted to have this conversation with you because I've read your book, The Anatomy of Anxiety. I read it in galleys, and if you can see how many pages I have marked, you get a sense for the fact that I was basically underlining every sentence until I just was like, okay, I'm just going to underline concepts. Before I do that, let me introduce you to whomever is listening to this right now, which is Ellen Vora, MD, is a holistic psychiatrist, acupuncturist, and yoga teacher. She takes a functional medicine approach to mental health, considering the whole person and addressing imbalance at the root. Dr. Vora received her BA from Yale University and her MD from Columbia University, and she is board certified in psychiatry and integrative holistic medicine. She lives in New York City with her husband and daughter. Did I say your last name correctly? Vora.
All of it. It's all perfect.
Okay, perfect. Okay. First of all, let me ask you what brought you to writing this. What was the spark?
Two-part answer. So on the one hand, I've been in practice now, I guess, a little more than 10 years, and I see patient after patient with anxiety. I get emails through my website and DMs on Instagram, and there is an epidemic right now. People are struggling, and who knows what Enneagram or type that makes me, but I want to solve the problems of the world. This is my little slice of that. This is where I feel like I have a helpful, unique perspective. So I've just felt really driven to put these words out in a broader way so that this can impact more than just the people in my small private practice. The second part of the answer is just that the impetus was really after my mom passed away. And there was a moment when I was having a treatment with a Chinese medicine practitioner, and she reports that she got a download from my mom. She knew nothing of my story. She just told me, I got a download from your mom. I was like, let's have it. And she said, okay, your mom says you need to stop reading books and start writing books. And my mom was a librarian, and she would read a book a day. I'm not going to say no to that. So at that point, I actually got started on the process.
And what year was that?
That was in 2015.
Well, let's start with your mother for a second, actually, because I read that part. It's towards the end, and you said, let me see if I can find it because I've marked that. You said, in July of 2015, when I was 6 months pregnant with my daughter, my mother died suddenly. After all those years waiting patiently for grandkids, I wanted her to be able to enjoy this experience. I wanted her to know my daughter. I wanted my mom's gentle, grounding presence in my life as a mother. I still want this. I cried when I read this. I lost my dad too young as well to cancer. And I think that this brings me to my first question, which is, when my father died, and I assume when your mother died, you had what you call in here true anxiety, right? I felt true anxiety, true grief, which are related, at the death of my father way too young. And then you also talk about false anxiety. And I think a lot of us suffer from false anxiety. Talk to me a little about the difference between true and false anxiety. And also, I just wanted to say, I'm sorry. And when we're done with this, we can have a longer conversation about dead parents, because I think it's worthwhile.
And I'm sorry too. Yeah, that conversation about dead parents, it's such a shitty club to be in, but we're in it.
Really.
And it is nice to not be alone in it, though. So full credit really goes to Julia Ross, who wrote the book, The Mood Cure. And she presented this idea of, we have our true moods. Something happens, you're in a mood as a result of it. And then we have our false moods. That's when you wake up on the wrong side of the bed, or seemingly out of nowhere, you're suddenly irritable, you're anxious, you're sad, you're angry. And our brain is really happy to swoop in with an explanation, right? Our brains are meaning makers. You give us two dots and a line, we're like, well, that's a face, clearly.
Right.
And if you give us a blood sugar crash and strong coffee, we have a revved up sympathetic response. We're sort of in a stress response. And our brain, trying to make meaning of it, is like, oh, I know what this is. This is that email I got from my boss. And it's also the fact that the planet is barreling towards certain destruction. That's why I'm anxious. When in fact, if we really had an omniscient peak, that's a retrofitted justification. And what really got us into that state of anxiety in that moment was a stress response in the physical body. And it's tripped up from something pretty benign. It's a mundane aspect of modern life, like being sleep deprived or blood sugar crashing or drinking strong coffee. So to me, that's false anxiety and true anxiety. True anxiety is there's something going on in your life. You're feeling deeply. This is purposeful anxiety. It's your true north. It's an inner compass. It's an inner sense of knowing. It's not something that we want to medicate away. It's not something that we can gluten-free or decaf away. It's really our truth, and our whole call to action here is to slow down and get quiet and listen to it. But our false anxiety, which I don't use the term false to invalidate the very real suffering in false anxiety, but it's to speak to the fact that there's a straightforward path out, that this is unnecessary, avoidable anxiety. It's not happening because of some big, deep truth in our life. It's happening because our physiology got out of balance because of the million different reasons of modern life that get us on a physiologic roller coaster day in and day out.
When you talk about those reasons for false anxiety, one of them that I laughed at was hangxiety, like being hangry, which I know, when I was pregnant or when I haven't eaten enough, that triggers anxiety as well. But let's go back to true anxiety for a moment, because one of the interesting things, while I was reading your book, I'm also simultaneously listening to Pema Chodron's When Things Fall Apart, because I just had a relationship blow up and I was like, all right, I'll finally read this book. And your book and her philosophy share so much, especially when we're talking about true anxiety. And one of the things I noticed that both you and Pema say is, we don't want to treat that anxiety. We don't want to medicate it away. We actually want it to teach us something. We want to sit with that anxiety. We want to sit with that uncomfortable feeling and appreciate it. Really kind of not love our anxiety, but to let it sit with us and let it tell us things. Do you want to speak to that for a moment?
I love these questions. God, you're so smart. I love you. So so I think anxiety, just an umbrella concept here, it's not the diagnosis. It's not the end of our inquiry. It's always a symptom. And by symptom, I really mean a communication. And, in false anxiety, that symptom of anxiety can be a communication, the body's out of balance. With true anxiety, it's really the wisdom of our body sort of piping up and trying to say, hey, pay attention. There's something here that you need to look at. And I think Pema Chodron really helps me also just get so galvanized in this view that certainly felt most front and center in my mind when my mom passed away, which is that relationship to reality. Like, are we resisting reality or surrendering to it? And like when a relationship blows up, when you lose a parent too young, when you lose a parent ever, we really want to resist reality. We want to say, no, this didn't just happen. This isn't fair. This isn't okay. This sucks. God, change this, make something different here. And I would notice myself get into those pathways and I would catch it and really try to go back to, I can be in profound sadness. I can be wailing in these primal levels of grief, but I can simultaneously be in a relationship to reality that's one of surrender and allowing and trusting rather than resisting. And that was the dance that I did for that, at least that first year after my mom passed away. And so I have no idea if that even began to answer your question.
No, it absolutely did. And I mean, also let me just bring it down to the personal level. When my dad died, I was sort of unable to deal with that anxiety and I was put on Lexapro. And after about a year of being on Lexapro, which just kind of evened things out, but I also, and you talk about this in your book a lot, about maybe we are over medicating anxiety, right? So after being on Lexapro for a year, I have a wonderful GP named Dr. Bertie Bregman, who I recommend to everyone. And he really believes in treating the whole body and treating illness holistically as well. And so I went in there and I said, I want to get off the Lexapro. What do you suggest? How am I going to do this? And he wrote on a prescription pad the word yoga and handed it to me. And I was like, oh no, I don't do yoga. No, that's not my thing. And he said, yes, but you're a rule follower, so I know you're going to do it. And I did. And, that was in 2008. And I found yoga to be life-changing. And in fact, it was a way to treat the depression, the anxiety, the loss, the grief in a way that was not only just helpful and useful to treat that anxiety, but it was life-changing, right? It got me into that state of understanding the breath, understanding the body, understanding somatic healing, understanding, what is grounding, right? And what I love about your book about anxiety is you talk about not just treating anxiety with pills, but let's treat the underlying issues that lead to the anxiety. What are some of those underlying anxieties that you could tell people about? Underlying, sorry, not underlying anxieties, but underlying triggers to anxiety, so that we treat it before it happens rather than after we're already feeling anxious.
Totally. Yeah. And I love this GP who put yoga on a prescription pad. He clearly knew you were like a Gretchen Rubin upholder. And he's like, all right, he's going to do it. And yoga was my lifeline throughout med school and residency. And, I think sometimes if only I'd found yoga earlier, I could have sucked like 100% less in college, resisting reality again. So I think that root causes of anxiety, they are manifold and we're all a little bit different. In the book, I put like a little cut out inventory that I almost intend for people to like literally cut out and just like put up on their fridge. Because in the moment, we don't have the presence of mind to be like, well, let me think about this 10 bullet point inventory. We really just need our partner or someone in our household to be like, is this because you didn't sleep well last night? We need someone to remind us, because we're just in the, tunnel vision rage of like, I'm anxious, I'm mad, I'm in this mood. So common culprits for false anxiety, blood sugar is a big one. We are living in the modern American food landscape where our diet's built on a foundation of refined carbohydrates and coffee drinks that are secretly milkshakes and rosé all day. And we're all on this blood sugar roller coaster. The design of the body is that blood sugar spikes, insulin chases it, then blood sugar crashes. And that precipitates a stress response. Cortisol and adrenaline are what signal the liver to break down its storage of starch. And that's a great design. It works. It restores blood sugar. Our organs don't fail. We survive. But it has as a little side effect a 5-alarm fire in the body. So we end up feeling anxious, panicked, overwhelmed. We can't sleep through the night. So many of my patients, just fixing blood sugar, just keeping it more stable throughout the day and overnight, sometimes just does away with a decades-long relationship to panic disorder. And sometimes somebody who's anxious all the time I've had patients just walk away from that diagnosis with no further interventions, just with regular spoonfuls of almond butter every few hours. So for a lot of us, it's actually just keeping our blood sugar stable. And then caffeine, I don't make any friends with this conversation, but it is a stimulant. It does create a little bit of a stress response in the body. It's not an inherently bad substance. I'm not here to like shame coffee drinking. I just want everyone to have their eyes wide open and make conscious, self-loving choices. Like, what's its role in my overall well-being? And PSA, no one should ever make sudden changes around caffeine because it's a very real withdrawal. And so you want to go gradually if you're going to make any changes at all. Alcohol is an even less popular conversation, but it's worth knowing some of the neuroscience around it, the neurochemistry effects. Alcohol rushes our brain with a neurotransmitter called GABA, which is very relaxing, but our brain is interested in survival and homeostasis. So it converts that GABA into an excitatory neurotransmitter called glutamate. And then that's why we have a tossing and turning, unrestful second half of the night of our sleep after we drink. That's why we feel on edge. And then we're like, you know what I could really use is another drink. And so that's the kind of withdrawal from that GABA effect that happens with alcohol. Even just chronic sleep deprivation. If we're not getting good sleep for 50 different reasons, our brain is more prone to anxiety. And being inflamed is another one I see really commonly. The list goes on, but that's a good starter.
So let's talk about the alcohol for a second. I stopped drinking alcohol about, 2014. So that's, 8 years ago. And it was life-changing. And I'm not an alcoholic. And I just did it because I was having that GABA glutamate thing that you're talking about in the middle of the night, where I'd wake up and I'd be like completely awake. And so again, this wonderful doctor said, try stopping drinking, and it worked. And one of the things that I find fascinating about human beings is that when I tell people I don't drink, they say, oh, were you an alcoholic? And I say, no. And then they get mad at you.
Mm-hmm.
It's an affront to their understanding of alcohol, of social interaction. And I find it hard still to say, I mean, I just, I put a boundary and I say, I don't drink. And then if they ask me further questions, I'll explain. But I just find it fascinating that people can't just accept this, I don't drink.
100%. Yeah, it's threatening. And on some level, it almost suggests, well, if you were also not a so-called alcoholic, maybe you should also reconsider your relationship to alcohol. And of course, nobody wants to do that. Nobody says this better in my mind than my friend, Holly Whitaker, who wrote the book, Quit Like a Woman. And she talks about how, I mean, she just blows open the whole idea about recovery and all this. She's brilliant. But I think that one thing in particular that pertains to what you're saying is like, we have this image in our minds of that's what an alcoholic is. Rock bottom, drinking alone, whatever it is. And as long as I'm not this other that I've pictured in my mind of what it means to have a problematic relationship with alcohol, then I don't need to take a look at my own relationship to alcohol. And so it's a nice, comfortable way of saying, like, I've designated that's the problem. I'm not that, therefore I'm fine. And, I'm someone who also doesn't drink. I'll maybe have a drink twice a year. I usually regret it. It's not worth it. It doesn't work for me. And then I also just have realized that it's never the act of self-love. And that's the compass. It's not like alcohol is bad, you're bad. It's never any of that. We don't need all this like shaming language. We don't need to think of alcoholism as 1-0. It's really just in this moment, is having the drink the act of radical self-love. Drink or don't drink, but do it because the reason you're doing it is because you love yourself.
So I had a moment last summer when my daughter was about to leave for med school, and we went on a mother-daughter trip to Paris, and it was our last night, and she was drinking throughout the whole thing. And I was just like, I want to share this moment with her. I'm going to have a glass of wine. I'm going to share this mother-daughter moment, this bonding moment. And of course I paid for it in sleep all that night. I mean, it was not an act of self-love. It was an act of love for my daughter, but it was definitely not an act of self-love. Getting back to med school for a second. So I went up there, she's at University of Buffalo, and I went just one random day and I happened to land on the Krebs cycle. Which was, but what fascinated me about just sort of sitting on this 4-hour-long Krebs cycle lecture was, in your book, you managed to bring in science in this really gentle way. So tell me a little bit more about GABA, because you mention it throughout the book and it's important for understanding anxiety. And I know that you know how to talk to an audience. I didn't understand the med school lecture very well, but I know you could tell us about that.
Oh, I don't know how good my Krebs cycle biochemistry recall is at this point. But so GABA, when we talk about mental health, depression, anxiety, there's a lot of conversation about serotonin. That's the neurotransmitter we've all cathected to, because really good marketing for Zoloft in the 90s, that was like, your serotonin is low, cute bubble says, and therefore you need to fill up your serotonin tank and then you won't be depressed anymore, as if it was so simple in mental health. But GABA is not part of the public conversation for the most part, but it's really equally important with anxiety. It's our primary inhibitory neurotransmitter in the central nervous system, which is blob for like, this is the neurotransmitter that helps you feel like, everything is going to be okay. And many of us can identify with the feeling of like, we're missing that in modern life. I think GABA is an endangered species of modern life, right alongside melatonin, and we can have that conversation if you like. But GABA, basically, we are doing so many things in modern life that are really decimating our ability to have good, juicy GABA modulation in our brain, and it's leaving us strung out and anxious. So we look at medications like benzodiazepines, things like Klonopin and Xanax and Valium and Ativan, and alcohol. These are really our GABAergic agents, and they're the ones that help us feel nice and juicy and GABAergic again. And that'd be great if it didn't come with a stinger. And again, our brain just always needs to get back to homeostasis in the interest of survival. GABA is so relaxing that when we have such a pronounced amount of GABA, our body thinks if the leopard did come around the corner, we'd be too buzzed to care. So it's not safe to be this relaxed. And so then what it does, it has all these different workarounds to get us back to a safe level of vigilance. With the benzodiazepines, it actually starts to board up our GABA receptors. And that's not a comfortable state to be in, because then once the Klonopin is faded out, you have normal levels of GABA in your brain, but the inability to almost hear the GABA because you're missing some receptors. And so then you feel on edge and kind of the opposite of everything is okay. And that's the feeling of coming down from benzos and being in withdrawal from benzos. And with alcohol, of course, it converts the GABA to glutamate. And then we just feel excited, agitated, activated, because glutamate is an excitatory neurotransmitter.
When you yourself specifically are thinking to yourself, okay, I'm in a state of less GABA than I would want, what do you have things that you do? Do you have ways that you cope?
Yeah. So here's how I think of like the natural approach to getting your GABA back to a healthy place. You actually do want to focus on the gut. There are two specific kinds of Bacteroides species of gut bacteria that help us manufacture GABA. And so if we've taken a course of antibiotics, if we're drinking chlorinated water, if we're just decimating our diverse ecosystem of bacteria, then we might be missing healthy populations of these bacteria, and then we don't get that nice shipment of GABA into our bodies. So I always come back to the gut. How's my gut doing? Do I need to eat more fermented foods? Do I need to soothe some inflammation in the gut? Things along those lines. Bone broth is helpful. And then
what are those fermented foods, just for people? So it's
Sure.
like kimchi and what else?
Kimchi, sauerkraut, beet kvass. If you tolerate dairy, kefir is good. Apple cider vinegar, miso paste, natto, if you can handle it. That's that like really fermented soybeans they have in Japan that smells strong. Yeah. And then I think there are a lot of other practices that can help our GABA signaling. Everything from cold showers and cold plunging to gargling to chanting and humming, acupuncture, craniosacral therapy, Reiki, meditation, breath work. And I think nutrition is still really critical. And it's not nutrition in the way we always necessarily think. Sometimes when we hear nutrition, we're picturing like green juice and chia seed pudding or something like that. And I really think it's about more of a ancestral perspective on nutrition. Like, what are the most nutrient dense foods that are going to pack a lot of punch? So things like chicken liver pate, ghee, egg yolks, the things that like really are Mother Nature's multivitamins.
Like avocado as well, yes?
Avocado, always great. Nobody argues with avocado.
Yeah. Switching around a little bit because we have so little time and I want to get to everything in the book. But one of the other surprising parts of this book was the middle sleep. So I had never heard of that term, middle sleep. I obviously wake up at like literally at 1:27 every night. And I'm very good about my sleep. I go to sleep between 9:30 and 10 every night without fail. I'm up at between 5 and 5:30 every day without fail. That's when I get my best work done. But this 1:27 a.m. awakening, I always think it's about going to the bathroom, but it's like, I don't really have to go to the bathroom that much. But now reading your book, I realized, that's just a natural occurrence and I should just sort of give into it, but don't look at my phone.
It's so liberating to know that it's middle sleep. So we basically think I'm up in the middle of the night. Oh no, like this is a bad night of sleep. Let me toss and turn. Let me look at the clock. It's so late. Oh no, what happens if I don't fall back asleep? Yeah. And we take out our phones. And then of course we're getting this shot of blue spectrum light, which goes through our eyes to our suprachiasmatic nucleus in our brain. And it says, good morning, the sun is rising. Even though it's 1:30 in the morning, our brain is like, it is? Okay. And then we start to have this, it just confuses our circadian rhythm for days on end. So middle sleep is just so powerful to just understand that normal physiologic sleep can be separated into two equal consolidated blocks of sleep. So say you're someone who needs 8 hours of sleep, I can't do this kind of math on the fly, but you might go to sleep at like 10 p.m. And then around 2 a.m. you're going to wake up. And your body needs to toss and turn a little bit, rotate, don't get ulcers, like pressure ulcers. Maybe you need to pee, but probably the peeing was not the reason for the wake up. The wake up is sort of going to happen and then is part of the system of how your body will evacuate urine in the middle of the night. It's sort of all built, in a nice design. Right. And so you'll wake up around 4 hours into your sleep cycle or into your overnight sleep. Have a few minutes. For some people, it's 5 minutes. It can be 15. It can be 45 minutes. It can be an hour. And then you're going to fall back asleep no matter what you do. And you'll have another block of 4 hours of sleep. The tricky thing is that we spin a narrative that gets us in a tizzy, and that is activating. And then we're wide awake. And if we look at our phones, we're disrupting our circadian rhythm, and that might make us wide awake. So if we let go and just allow it to be the middle sleep, and just, it's okay that we're up for a little bit in the middle of the night, don't bring any drama to it, we'll fall back asleep, and there was no harm, no foul. It was a good night of sleep. So it's a really powerful understanding.
One thing I noticed in my waking up at 1:27 is that if I look at my phone, I'm doomed. But if I look at my Kindle, I'm not.
Yeah.
So I don't know what the light of the Kindle is, but it must be, I mean, because I can read on the Kindle and then just sort of gently, I'll wake up with the Kindle in my hand 4 hours later.
That it's like a two-part reason. I think one is that truly the light quality is a bit different. It depends on your Kindle, but there are more settings on the Kindle to make it really like orangey dim. It's not so disruptive to the circadian rhythm from a light perspective. But there's also the nature of what we're doing on those two different devices.
Right.
And whereas the phone is like geopolitical news events, and dating apps, and TikTok, and like, the endless scroll. Whereas the Kindle is the soporific motion of our eyes scanning across a page, which is itself conducive to falling back asleep. So yeah, if you have to have a device that you reach for during middle sleep, let it be a Kindle. And this is all great because anybody who's read my book knows that they're never going to have their phone on their bedside table again.
Right.
So there you go.
Well, you don't have teenagers yet, though, so that's a problem.
I see your point.
That's a problem. Yeah. So I have a 15-year-old. I can't not have my phone next to my bed, unfortunately.
I get that.
But
Can it be across the room? Yeah.
Yeah.
I think
far enough away.
Not arm's reach is an important difference.
Yeah. When you and I met, so Ellen and I met, for everyone that's listening, at a party it was Justin McLeod and Kate McLeod's party.
Yeah.
And I remember very clearly that we had a very intense conversation about psychedelics, because I credit dropping acid in college with sort of life-changing decisions that, and perhaps 10 years of psychotherapy in one night, or I feel that way. And I still can recall insights that I learned about myself during those trips. So sort of ego death and all of that happens in the psychedelic experience. So much so that I know this sounds crazy, but when my children, my older ones who are now 26 and 24, left for college, I was like, this is the time to do this if you can. If somebody has, mushrooms or acid, like, try it. And everybody thinks I'm crazy for having done that, but my children also said they were glad that I gave them sort of permission, and they also learned a lot about themselves in so doing. Talk to me as a psychiatrist, as an MD, about your beliefs about psychedelics.
Yeah. So all the caveats, right? I don't just say this from a lame kind of medical, legal check the box. Like, I truly, madly, deeply believe that they're not right for everybody in all settings. Like, it's when indicated, when safe, when appropriate, in a therapeutic setting, blah, blah, all of that really is essential. And you have to kind of know who it's appropriate for. There are people with brains that are already on the chaotic end of the spectrum. We don't need to introduce more chaos into that system. Not only is it not beneficial, but it's potentially deleterious. But if we're stuck in any way, if we're entrenched, if we have a limited sense of ourselves as an individual, we're not feeling that deeper interconnection, if we have OCD, if we have substance abuse issues, if we have depression, if we just, I think if there's anything rigid or stuck, I think psychedelics are so transformative. And as a psychiatrist, I'm just excited about the implications for treatment, because I have a practice full of people, and, one by one, when I feel like it's the right time, I'll throw it out there as, is this the right time to consider this kind of intervention? Met with varying degrees of like, oh, or like, but I think that what I've noticed, what I've witnessed is that this is often the transformative agent. After years of sort of making only so much incremental progress, somebody really has a real, something that just completely changes the trajectory of their healing. And I think it works for so many reasons that make sense to me. I mean, it works in certain ways, in a way that's overlapping with our antidepressants. It's active at our serotonergic receptors, like our 5-HT2A receptors. So it's kind of this like huge macro dose of an antidepressant that doesn't seem to have any of those numbing effects or withdrawal effects. It just seems to kind of rev up our serotonin signaling in a way that's enduring. And then it's also anti-inflammatory. That's always nice in modern life. But more interestingly, there's the impact on brain-derived neurotrophic factor, or BDNF, which is sort of this opportunity to inject neuroplasticity and neurogenesis. And this is a lot of heavy-duty science talk, but it's basically to say, like, we can grow and change and adapt. We don't have to stay stuck. So you can imagine how in treatment, you can have an experience like this, and then in integration, which I think is 90% of the benefit, you work on how do we want to look at things differently. And it's such an opportunity, whereas usually the brain is sort of lodged and entrenched in its view and its narrative about life. In a window of time after a psychedelic experience, it's like, I could try that on for size. I could look at this differently. And there's the impact on our default mode network, that part of the brain that sort of tells us, this is me, these are my limitations, I, me, mine, that's them. And to quiet that down temporarily really calls into question this limited definition of the self and what are our, what are we connected to? And I find that that's so therapeutic for anybody who feels lonely or alienated or resentful of others. There's almost an empathogenic quality to not just MDMA, but I think all of the psychedelics that really helps us feel more connected to others.
Which psychedelics are you able to treat patients with at this point legally?
I don't facilitate anything. So legally right now it's ketamine,
right.
But I'm always just quarterbacking. So I might send somebody to a ketamine center. Sometimes I'm encouraging people to go internationally to have a legal experience with something like psilocybin or ayahuasca. Some of my patients work with underground practitioners who offer these medicines in the United States. Huge debt of gratitude to the practitioners who really put their license and their livelihood at risk in order to do this really important work. That's basically how I quarterback it. It's a little different for everyone, what's going to be the right medicine and the right boundary around what feels responsible.
Right. You were about to have some sort of epiphany moment also about connection and community. And so I want to bring it back to love for a second, because you say something beautiful. I mean, it was like, I marked it with my ponytail holder so that I could get back to it. But you said, every religious text, mushroom trip, and sophomore poem will offer the same revelation. The answer to our growing discontent is love. And yet, despite the fact that the answer is easy, the real test is how we find it in our lives, how we show up, treat each other, offer ourselves in service to the world, and make our unique contribution in life. Talk to me about your relationship to love and the scientific relationship to love.
Yeah. I think that's really the gift of psychedelics, is that they can take every Hallmark card you ever read and give you a felt experience with the cliche. And I think a cliche is kind of useless until we feel it. And we can't feel it somehow until we're tripping or we just gave birth, or, it's hard to really, really feel, oh, everything is love and this is all that matters. And I think psychedelics give us that royal road to, okay, love is everything, relationships are everything, and we feel it, and we're embodied by that knowing in a way that's hard to think ourselves into in the rest of our lives. My relationship to love, so you said you had 10 years of psychotherapy in one night with psychedelics. I often get the experience in a psychedelic ceremony, like I'm in therapy with God. Like God is my therapist. Very nice, great sense of humor, knows me a little too well, but, jabs at me lovingly and humorously. But it's basically like, and you know what you need to do here differently. And you see your shadow here. And it's just this loving therapy. And what it's really helped me come away with is a feeling of being guided. I just feel a little less alone in this great cold universe. I feel like there is a loving, benevolent presence there. Doesn't mean all is hunky-dory. Doesn't mean I always get my way. Doesn't mean the world is going to be okay. It's nothing like that. In certain ways, this God figure is also like, universes are going to universe. Like, I don't have skin in the game. It's going to expand. It's going to contract. Like, shit's going to happen. But to keep helping me grow towards a better version of myself, towards light, basically. And I feel that guidance, and it makes the universe feel a lot more loving. And I have found, in a very mundane way, my relationship with my husband, my ability to really enjoy my daughter, all of that has been advanced and really, enhanced through work with psychedelics.
Have you ever read the book by Thich Nhat Hanh? It's just a very tiny book called How to Love. And I
Yes.
find it to be sort of a seminal text for me. I go back to it again and again. I can read it in 20 minutes and I just return to it, especially in moments where I feel like I've lost love or there's a rupture in love. And I love the idea that just love exists and you can tap into it whenever you want. But we so often forget to tap into that love for our fellow man and woman, love for friends, love for a partner, love for parents, love for children. And that really, without it, that is what leads to this anxiety, depression, everything. And I think you say that, beautifully in what I read before. But I think it's also important for us to remember that anxiety and love, that love can balance out anxiety.
Yeah, I think that there's something so, I don't have the answers here, but there's something at the heart of true anxiety that has to do with the fundamental worst case scenario idea of existence, which is one day you die and one day you lose the people that you love. And, who can argue with that as the worst case scenario? That's really what hurts. And I think that a lot of people with anxiety are sort of living in a constant state of what can I do to prevent these things from happening? How can I white knuckle existence so that I don't lose the people that I love, so that we're getting them the best doctors and we're going to scan their whole body and check for cancer and just prevent any possibility of this worst case scenario. And I think the tricky task is that sometimes preventing death sort of stands in the way of us really living our lives and enjoying it. And I'm open to questioning the idea that the end is not the end, and that living in fear of that, especially in a way that steals our ability to enjoy our life, it is not even accurate, that that's something specious about that really at the very end of the day, there's something much greater than our comprehension is ever capable of making sense of, and that it's not so absolute. And so I think that we want to tap into love because it's sort of like the thing where I really love the Elizabeth Gilbert passage I include at the end, like when she's grieving her partner. We just want to show up for this full human experience, all the exquisite pain and grief and ecstasy and rage and everything that comes with it. I think love is in certain ways like it is at the center of all of those different emotions. They all connect back to, because we love, we grieve, and because we love, we hurt in all these ways. And I think that that's what we're here to feel. And I don't blame anybody for getting distracted from it. Our life makes it pretty difficult, but it's nice to just keep getting a reminder. And I think anxiety is sometimes the forgetting that we're here to feel it all.
I was prone to high anxiety until I nearly died. So I had a moment where I had something called vaginal cuff dehiscence. I was near death. Doctor said I was near death. My daughter was with me. I was in the hospital in the emergency room waiting to be wheeled in for emergency surgery, and I could feel my body dying. And it wasn't scary. There was a moment where I realized I'm in the room with my daughter. I'm about to die. It's okay. I've had a wonderful life. And I draw on that all the time now to rid myself of sort of the day-to-day anxiety. Just like I almost feel reborn from that near death, meaning I am cured in certain ways of feeling deep anxiety. And not that I would wish everybody could have a near-death experience to understand that the near death is not that scary, but I'm saying it out loud because I think it's important to understand that anxiety is part of what our brain does rather than what we are.
Oh, I really love that. Let's add that as an endorsement onto the back of the book for the last minute. I think it's already at the printer. But I think that I get a message from my mom. Like I'm always asking for my mom to send me any kind of communication. And she always tells me, I'm okay. I'm good. And, I want to have this heavy story of like, are you missing getting to grandmother these kids? Are you sad to be missing this? Are you sad for us being sad about missing you? And it's always so much more a feeling that comes through of like, it's really okay. It's okay. And I do think that I'm not here to force any worldview upon anyone, especially like believing that people exist in spirit form after death. Like that, you can't, there's no proselytizing that. If you feel it, you don't. But I just encourage people to, in the words of, is it Rilke, that to live the questions. And you just want to be seeking. You just don't want to have to like have a knee-jerk reflex assumption of like, no, that's dumb, it's crazy, don't even think about it. Just be open, just be curious about it, and seek and ask these questions. And I think that sometimes, once in a while, you even get a little transmission of like, actually, it's okay. You are okay. You're going to be okay. Things are going to be okay. Even when things can be really pretty terrible. And it doesn't make sense, but I think it is incredibly grounding and comforting. And I encourage people to just be open to that line of inquiry.
I didn't believe anything about messages from the dead until my father died. And I'm not going to go into all of them, but I'll go into one specific one, which was I was at my daughter's white coat ceremony, which is when they get their white coats. And I was crying a lot because, you know, seeing her up there walking across the stage. And my thought in my head at the time was, God, I wish my dad were here to see this. I'm so sad that he's not here. And I had my phone in my hand because I was taking photos, and I accidentally somehow pressed Spotify. And suddenly the Sounds of Silence came on, which is his favorite song and the song that he made my son play at his funeral. Freaked me out. But also I was like, oh, okay, there's another sign. And I just, you know, I turned it off, but it was like, it was a little loud. And I took it as my dad saying, I'm here, don't worry, I got it, I'm watching.
Yeah, that's exactly right. I find music is actually the number one way that my mom communicates to me. And it's a beautiful thing about modern life, streaming music and shuffle, is that when the dead need to communicate something, they can just use the shuffle feature. And then it's a 1 in 50,000 chance that that song comes on, and there it is, you know? And so
I want to go from the, you know, the prosaic to the mundane for a second. One thing we didn't get to talk about, which I want to talk about, is I can't remember the name of it, the pesticide that you were talking about, that you were away in Europe eating bread and the bread was fine, and then you came back here. Rebound? No, what is it called?
Roundup.
Rebound.
Rebound would be a great term for pesticide.
Roundup.
Monsanto, right. Take note. Bayer now, I guess. Yeah.
So talk to me about the bread thing. I was actually fascinated by that.
Yeah. So, I mean, you mentioned yoga, and it reminded me about how like everyone is like, oh, I don't do yoga, I don't eat gluten-free, until they like reluctantly at some point sort of half try it. And they're like, oh shit, I feel better. Now how am I going to go like integrate this into my identity? So these snowflakey Portlandia things like being gluten-free, I get it. It's mockable. I get it. It's annoying in a restaurant. I get it. I happen to be a daughter of a celiac. I have a sensitivity to gluten. And I tend to feel like my body is almost this testing ground that helps me be a better doctor to my patients. So I'm sensitive to everything. So I can feel what in modern life can mess us up. And at least just helps me know some of the things to throw out there as suggestions for my patients. Like, you might want to experiment with this. Gluten is a really interesting one. The 1-0 aspect of it is celiac disease. If you're celiac, which has a genetic component, and then there's some other conditions within life that can sort of make that genetic predisposition manifest into celiac disease. If you're celiac, gluten is gluten. It doesn't matter where in the world you are. It's going to cause a bad reaction. It's going to create immense amounts of inflammation and damage to the small intestine, and it shortens your lifespan. It's not cool. Then there's this whole other realm of people with non-celiac gluten sensitivity. And that is an interesting group of folks. And some people here, it's almost like an orthorexic condition where we start to fear food, and we've decided this food is toxic and it's bad. And then we almost have a psychosomatic reaction when we eat it, because we're like, oh God, it's gluten, it's going to hurt me. And then I think I have a tummy ache, and it's sort of that whole thing. I think I've created this for some of my patients. So this sits heavily with me, the whole issue around fearing certain foods, in trying to help people know, you might want to try avoiding this and see if you feel better. There's also a lot of us that are truly having a reaction to it. There's all kinds of ways you can demonstrate that experimentally. I always have the reaction and then call the restaurant. I'm like, does your rice have gluten in it? And they're like, yes, actually. And it's like, oh. And so, like, my body is such a weather vane with this. But I think that within that, it's not necessarily just the gluten. And in places like Europe, there's much less use of the pesticide Roundup. The active ingredient is called glyphosate. And I personally am someone who tolerates gluten in other parts of the world, and then 100%, make no mistake, do not tolerate gluten in the United States. And I've done all the experiments. Like, what if I'm in vacation mode? Hawaii, don't tolerate gluten. What if I'm stressed in Italy? Tolerate gluten. So it's something to do with the way their agriculture is producing the wheat crop. I'm open to the idea that it might even be a kind of synergistic relationship with the water or even the yeast in the air in these areas. But for people who don't tolerate gluten, it may well be that you do tolerate it in some parts of the world. So it's worth doing some self-experimentation to know where the line is for you.
Quick, silly question. Oatmeal in the morning. So steel cut oats. Will that be a good breakfast for people?
It is within the realm of, it can be fine, like especially steel cut. It's a little bit proteinaceous, a little bit slower to digest. I was a diehard every single morning oatmeal eater, and I was doing like Bob's red mill gluten-free oats, sometimes steel cut, sometimes quick cooking. And I think it's a lovely breakfast, doctored up with frozen blueberries and pecan pieces and cinnamon. It's nice. I have recently actually shifted to a protein breakfast, eggs, bacon, sausages, avocado. And I have found that it allows for more stable blood sugar throughout the day. And this is really just in the last couple of months I've made this transition. So if anybody is feeling like, I love my oatmeal, but I am a little blood sugar swinging, it might be worth starting the day with protein. But if oatmeal's working for you, it worked for me for years, and I think it's a great breakfast.
And what about yogurt? Like, I know in Greece, the basic breakfast is yogurt with figs and a little honey.
So nice. So dairy is one of these things where it's like you either tolerate dairy or you don't. And if you tolerate dairy, you're so lucky because it's divine. And if you don't, we have to be honest with ourselves, because while it's delicious, if it's making you inflamed and giving you SIBO and making you anxious, it's probably not worth it. And within tolerating dairy, there's a spectrum. Like, more of us are likely to tolerate non-goat dairy or non-cow dairy, things like goat and sheep. Full fat, unpasteurized, fermented tends to be more easily digested, whereas something like a glass of skim, conventional cow milk tends to be pretty universally inflammatory.
So we have only a few more minutes left, but I want to leave the floor open to anything that we didn't discuss that you really want to get out there about anxiety, because you started writing this before COVID, right?
Yes.
Yeah. So who knew that when you started writing this, that it was going to be the book? I mean, I'm going to hold it up again, because I really think that this is the book for the COVID generation. And I think it's going to help so many people deal with, we're all going through PTSD right now. All of us, we're all dealing with either whether we had relatives die, whether we ourselves had COVID, whether we're germaphobes and we can't even go to the grocery store. Everybody I know is dealing with anxiety right now. And so I guess what I want to ask you is, as a care professional, as a human being, what sort of general things can you tell people right now about how to handle anxiety as we come out of this period? And I say that with all hope in the world that we're coming out of this period.
Yeah. I mean, I was writing this book before the pandemic, and we were already fully in a proper epidemic of anxiety even before the pandemic, but it has certainly even become astronomically worse of a problem since then. I think that the most important message here is one of hope. And things are grim right now, right? Our kids are more screen addicted. Socialization is weird. They fear touching other people. They've seen their parents struggle and be so anxious all this time. We're collectively grieving. There's been a collective trauma. We're hyperpolarized. It's grim out there. But part of the main message of this book is to recognize that these two kinds of anxiety, false anxiety and true, when it comes to the false anxiety, it doesn't have to be happening. And there's just this initial paradigm shift, which is to understand that a lot of mental health is really physical health. And 7 years of psychotherapy is a whole ordeal, but getting your body a little bit more nourished, a little less inflamed, and better slept can be addressed in a matter of weeks, and you can just feel less anxious. And so the false anxiety part, it's low-hanging fruit. There's really actionable strategies you can do and just be less anxious, really quite readily. And then the true anxiety part is not something we should be pathologizing. This is the anxiety we need to feel. We should be feeling a certain degree of true anxiety coming out of this pandemic. Our hearts should be hurting with our polarization, with all of the loss, all of the grief. There's so much to feel right now. And I think we've all come of age in this emotion phobic culture that tells us if you cry, apologize and suck it back in, like the way we would pinch a sneeze, and it's like, we need to be feeling, we need to be crying, it needs to be ugly. We need to be hurting and diving into the full range of what's coming up for us. That's what keeps us unstuck. That's what allows us to metabolize these feelings. So coming out of the pandemic, get strategic and eyes wide open, conscious, self-loving choices around caffeine and gluten and alcohol and sleep and relationship to our phones, and get all that straight so that you don't need to be feeling any unnecessary anxiety. But then when it comes to our true anxiety and our true feelings right now, I say dive into it and feel it. And we need to be crying more, processing more of this with each other.
And then one last question before I say goodbye, which is, a lot of people are not going to be able to deal with their anxiety, and they're going to need to seek out somebody like you. You and others like you are quite busy right now. I know this from having somebody I know very well trying to find a therapist right now and unable to because either the cost or the people that he wants to see are not available. What are some resources that you can tell people right now to be able to find the psychotherapy or the therapy that they need? Because
Great
it's
question.
grim right now.
It is. It's really hard. That also is already a problem. Accessibility, affordability. It's hard enough to make the first phone call and be like, okay, I need help here. And we know about the expense. We know about the wait lists. We know about the headache dealing with insurance. There's a lot of barriers to getting into good care. And then I have my own pet peeve barrier, which is that you could get into good care and then you talk for 15 minutes and you walk out with a prescription and it's not necessarily truly what's indicated. And then you're just sort of like being vaguely managed remotely, a little check-in every 6 months, and you're just taking this medication. And it's not the holistic 360-degree approach to really helping you thrive and achieve fulfillment in your life. So it's a problem. Part of my book is here to say, we don't need to gatekeep so much of mental health care. It doesn't need to happen in the ivory tower of the office with the psychiatrist. There's a lot more that determines our mental health that's actually under our control. Our sleep, our diet and lifestyle, how we're feeding ourselves, all of that, exercise, like these are things we can do for ourselves. They're safe, they're affordable, they're accessible. And these are interventions that can make us literally less depressed and less anxious. So part of what I want to do is just say, here's what you can do if you can't get into good care. If you still need care, if you need professional help, there are nice innovative startups at this point, places like Octave. I think there's one called Alma. So I think a good Google search also helps you find the places that are making this a little bit more accessible at scale. I love Group Model, which makes this a lot more accessible, more affordable, and it has this community element that I think is itself therapeutic. So finding a good group is a great way to access care. It doesn't have to be one-on-one individual care. And I think sometimes take it out of the traditional mental health settings. If you can't find a good practitioner you jive with, or it's not affordable, or whatever is the problem, think about other kinds of practitioners. Health coaches can be helpful. Naturopaths can be helpful. Functional medicine doctors, Reiki practitioners. It's really, at the end of the day, chemistry. Is this somebody knowledgeable? You can trust them, and they see you and they get you, and you feel safe and supported in that setting. And sometimes that's not actually something we can find just through looking at people's credentials.
Right. That I have to ask one more follow-up, because for people to get into a group situation, what's the best way to do that?
There's no one size fits all answer to that. Like these startups like Octave could have a group care model. I would Google it in your area. I would ask around word of mouth, but basically there's a lot of practitioners in places like Instagram even that are starting up their groups. And so there isn't like here's the one clearinghouse database where you can find the group near you that's taking new patients, but just sort of creatively look around and figure out where are practitioners doing things differently.
Well, thank you very much. I want to hold up the book one last time. This is The Anatomy of Anxiety by Ellen Vora, MD. Thank you so much for taking time out of your day to talk to me, and we'll chat off screen after this, okay?
Deb, truly, thank you. Thank you so much.
Thank you. All right, I'm gonna get out of here. End the recording.